Hello and welcome. This is Dr. Asra Saleha, cornea and refractive surgeon at High Tech Eye Hospital, City Chowk, Aurangabad. Today I'll be talking about LASIK surgery, a procedure that has transformed millions of lives by reducing or eliminating the need for glasses or contact lenses. So LASIK, also known as laser assisted in situ keratomileusis, is a procedure which is quick, minimally invasive, and it reshapes the black portion or the cornea of your eye, thereby reducing or correcting the refractive error of your eye. Though LASIK is just one procedure amongst the wide spectrum of refractive procedures like contura, epicontura, femtolasic, smile, and whatnot, but LASIK is still the most commonly performed procedures. So, in LASIK surgery, we basically reshapes the cornea, that is the black portion of your eye. The procedure is very simple. It gets completed in 10 to 15 minutes only for both eyes. In that, we make the thin flap of your cornea, that is, this is your cornea. We make a flap, we lift the flap, we fire the laser, we reshape the cornea so that light will now focus on the retina, and then we deposit the flap back. So who are the good candidates for LASIK surgery? Those having stable refractive error, that is, that the refractive error did not change in last 1 year. Those having age more than 18 years, those not having any ocular illness, any corneal diseases, or any systemic conditions are the good candidates of LASIK surgery. So there are various benefits of doing LASIK surgery. First is convenience. Imagine waking up in morning and seeing clearly without having to reach for glasses. The second benefit is safety. The procedure, due to advancement of LASIK procedure, that the surgery is very safe and it is very precise. Third benefit is the cost and the time period. The procedure gets completed within 10 to 15 minutes, and the recovery, the patient can see clearly from the very next day. Some patient might require 8 to 10 days for full recovery, but patient can see clearly from the next day. So the surgery is very safe and precise, but like any other surgery, it is not without any complications. The complications of LASIK surgery are photophobia, glare, halos, dry eyes, which are the temporary complications. There are some more dreadful complications like infectious keratitis, scarring following keratitis, and flap-related complications, but again, there are very rare complications. So there are various myths associated with LASIK surgery. So we'll now see the myths and facts of LASIK surgery. The first and foremost question we get asked, is it painful? Is LASIK surgery painful? So the answer is absolutely not. The surgery is painless procedure. We use numbing drops to numb your eyes before surgery, and the surgery is painless, sutureless, injectionless, bladeless, bloodless, and yet very fruitful. Some people may have confusion that the LASIK surgery is only for young adults, not for older people. There is no upper limit for LASIK surgery as long as the patient is fit and that they meet the criteria for LASIK surgery. The third most commonly asked question is it costly? Is LASIK surgery costly? So the LASIK surgery might seem upfront a very costly procedure, but in long run it is very cost effective considering the expenses of glasses and contact lens you have to bear throughout life if you're not if you're using glasses. Then some might ask, is the refractive error gone for life? So you should understand this. LASIK surgery, though it makes the refractive error zero, but now your eyes are behaving like any other eye. So normal eye. Even the normal eye will have some changes with aging, so is your eye. The patient will have, after 40 to 45 years, presbyopia, and you may require near glasses to read clearly. People may have doubt like, can LASIK cause complete blindness? So there are some complications of LASIK surgery, but it will never cause complete blindness. All the complications are treatable and curable. People might think that LASIK is only for myopia or nearsightedness, but it is not the case. LASIK can be used to correct myopia, hypermetropia, or astigmatism. It can correct up to -8 diopters of myopia, +5 diopters of hypermetropia, and +3 diopters of astigmatism. So remember, your eyes are one of the most precious gifts that you have. LASIK is not for seeing better, it is for feeling better and for living better. So take a step forward towards brighter and clearer future because your eyes deserve nothing less. Thank you.